much. It's my pleasure to present the results of a phase 3 randomized double-blind study of chemotherapy plus or minus midostaurin in newly diagnosed adults with mutant FLT3 AML who are between age 18 and 60. I present on behalf of the Alliance and many other cooperative groups throughout the world. We're targeting FLT3, which is an activating mutation in AML. It occurs in about 35% of patients with AML. About 3/4 of patients with the mutation have an ITD or a length mutation in the juxtamembrane region, which causes a poor prognosis. Midostaurin was tested in the test tube. Initially, it was shown to be a FLT3 inhibitor, a potent one. It worked in cell culture and in mice. Early clinical trials showed that there was activity, but limited as a single agent. When we combined it with chemotherapy, we proved we could do it safely, and we had some encouraging results from a phase 1 to 2 trial we did a few years ago. And we then embarked upon CALGB 10603, or the RATIFY trial, the scheme of which is shown here, which involves registration to having AML, then a rapid assessment of the FLT3 status done by one of 9 academic labs around the world. If you had the FLT3 mutation, you could go on the trial. You were randomized to either standard chemotherapy and induction and post-remission therapy with placebo or with midostaurin. The primary endpoint of the trial was overall survival, which is very important, uncensored for transplant. So this is very much of a real-world trial. We just took patients from the start and saw how they did till the end. We screened almost 3,300 patients. Remember, only a subset could go on the trial, and of those, 887 had the mutation, of whom 717 went on the trial. They were balanced, of course, according to the midostaurin or placebo. This slide shows the top-line results. There is an overall survival benefit with a hazard ratio of 0.77 and a significantly low p-value of 0.078 in favor of midostaurin for overall survival. The medians are quite different, 25.6-month median survival in placebo and 74.7 months in midostaurin. That seems like a lot, but it's really having to do more with the way the survival curves turned out to be shaped. Event-free survival was also positive in favor of midostaurin with a one-sided log-rank p-value of 0.032. There were a lot of early events because you had to achieve remission by day 60 per protocol guidelines. The event-free survival was also beneficial in terms of the median event-free survival for midostaurin, 8 months versus 3.6 months for placebo. So in conclusion, CALGB 10603 RATIFY is an international academic collaborative AML study based on genotype of diagnosis. That's a key point, and it's feasible to do that kind of a trial. A lot of collaboration, a lot of cooperation, a lot of persistence, because the trial took a long time to conceive of, conduct, and analyze. Midostaurin is a multi-targeted kinase inhibitor that improves event-free and overall survival when added to standard chemotherapy, again during induction, consolidation, plus we use it for 1 year as maintenance in newly diagnosed patients aged 18 to 60 with FLT3 mutant AML, and the trial was positive whether you censored the patients after they got a transplant or kept following them for the whole time. So there's lots of other areas where midostaurin can be studied. Older adults with AML, both FLT3 and FLT3 wild type, and younger adults with wild type FLT3, because this is a multi-kinase inhibitor and may work in other subsets of patients with AML. So thanks a lot, and